Hi, so let's learn the steps involved in L5-S1 endoscopic disc surgery. So here we are going to do a right-sided L5-S1 discectomy surgery through endoscopic approach. This is causing right lower limb radicular pain to this patient. We under GA position the patient prone and mark the surgical level under C-arm. We place the needle around the interlaminar area. We also check in APE to see where the needle is placed, because our entry portal is actually around the interlaminar area, which is actually around the lower part of the L5 lamina. We give a skin incision which is around 7 millimeters, and through this we will be doing the surgery through these tubes. So we put sequential dilators, and then we put our operating scope, and then we check the position of the tube again. So we normally place it near the lower part of the L5 lamina or interlaminar space. Then using a RF probe, we burn the muscles and the fat until we reach the lower part of the L5 lamina. Through this dissector, we feel the L5 lamina, elevate the muscles, and using a curette like this, then we remove the ligamentum flavum attachment from the lower part of the L5 lamina. We move in a C-shaped manner, and we keep on removing the ligamentum flavum from the lower part of L5 lamina and then laterally from towards the facet. During this process, we try to remove the flavum as a cap in this fashion. We remove very little of the bone, and through this window then we are able to see the nerve root, that is the traversing nerve root. Using a hook, we try to reach underneath the root, and then we remove the loose flying disc fragments. So normally these loose fragments are the ones causing the pain to the patient. So whatever has come out of the disc area, we remove those fragments first, protecting the nerve root. Here you can see we are removing the disc fragment using a disc forceps. So we remove these fragments first, which are loosely lying outside the canal, and once we are satisfied that we have removed all the fragments, then only we try to enter the disc space. For entering the disc space also, now there is a special equipment that we use. We basically use this nerve protector, and we rotate it in such a way that the nerve is protected, and through that only we enter the disc space. Now this protects the nerve root while we are removing the disc fragments from near the annulus area of the designated disc space. Now once the nerve is protected and the rent in the annulus is visible, we remove the loose lying disc fragments near the posterior border or posterolateral area of the disc using disc forceps. We try to remove very little of the disc fragments from inside the disc space, and now you can see that the nerve is free. The central canal is also very well visible. So here through the tube only, here through the endoscope only, we are able to remove the disc fragment that was offending the nerve root, and now the nerve is totally free. Now before leaving, we use a radiofrequency probe to basically we burn the annulus and the loose lying disc fragment so that the rent is sealed. Now once the surgery is done, we remove all the instrumentation and we take off any additional saline. Now here you can see the incision is very small, almost the size of the fingertip. So that just requires one single stitch before we close it, and hardly any dressing is required. On between 7 to 10 days, we even remove this one stitch that we had put.